Good afternoon, everybody. How's everybody doing? Lunch was great. So welcome to the sessions where we now start to dig into some of the details and the specifics around Denver and other jurisdictions' approaches to different aspects of marijuana regulation, enforcement, and education. So this is the Youth Prevention and Education Panel. Hopefully you all are in the right place. My name is Molly Duplashane. I am the Deputy Director for the Department of Excise and Licenses, and one of the original 5 members of the Office of Marijuana Policy. So I started the position back in 2014, as Ashley was talking about earlier this morning. The other panelists we have up here are Leah Emmerich. She is the Prevention Coordinator with Denver Public Health. And then we have Ed Charlson, who is the Program Administrator for the Office of Behavioral Health and Strategies, which is an office within the City and County of Denver. And then we have Brianne Goldman, who is a curriculum designer with the YES Institute. YES Institute is an organization that is funded through the City and County of Denver's Healthy Lifestyles for Youth grant program, which I will touch on briefly. The other kind of missing part of this panel is our folks from the Office of Children's Affairs with the City and County of Denver, and both of them were unavailable and out of town today. So I will be doing the brief overview of Denver's approach to youth prevention and education, and then we'll pass it over to these guys who are our partners in this effort. So just as a background and some kind of foundation information about Denver's approach to youth prevention and education, we really wanted to take the same strategy that we took with how we approached regulation and enforcement and have that collaborative model. So as the Office of Marijuana Policy, we took that centralized or central point of contact and try to coordinate the efforts. And so we kind of look at a couple of different areas for those efforts. We look at youth prevention, which we'll talk about today, and youth diversion, which Ed will be talking about today. And then we also, in our other education efforts, we have our public awareness campaigns, which I think are in a session tomorrow afternoon. And then data collection, so we work with Denver Health and other stakeholders to collect data, to monitor usage information and those types of things, to inform our education efforts. We have a whole data collection session at the symposium too, and then we partner with the state on their campaigns and sit on some of their committees and advisory sessions on their education efforts. And in 2018, I put a breakdown of where our funding goes for each of those efforts. Our Healthy Lifestyles funding is really our prevention funding, which we'll talk about today. And then the other major portion is our public awareness and our behavioral health. And so we'll talk today about a lot of the great work that is being done currently and has been done and will continue to go on in the future around our education efforts. And so I just wanted to give you a little picture of how Denver got there. And my previous background was in the budget office, so I think in terms of dollars, and so that's how I'm telling the story here. So in 2014, when we first established the Office of Marijuana Policy, and all of this was so new to us, we were kind of struggling, figuring out how to focus our education efforts. And so what we did was we gave some funding to our Office of Children's Affairs and really coordinated with the state's efforts on a campaign that they had going at that time. We also then started contributing funds to Denver Health, which is doing our public health and youth usage data collection and monitoring, and also had some issues around parks and recreation and public consumption, so we put some funding there towards education. As we started to evolve into 2015, and working through our Office of Children's Affairs, we kind of focused those funds a little bit more. We gave the Office of Children's Affairs another $250,000, and they established their own grant program, which is called the Healthy Lifestyles for Youth, which, as I mentioned, Brianne's organization is a grantee of those funds. And I'll talk about those in just a second as well. And then we continued that data collection, those funds. In 2016, again, we continued to evolve and learn a little bit more about how marijuana legalization was impacting youth. And so we focused our efforts a little bit more. We kept our funding in the data collection, and we kept our funding in that Healthy Lifestyles for Youth. And then we also started to partner with our Office of Behavioral Health Strategies and looked at more diversion programming. And that's what Ed will touch on today. With our prevention programming, we really wanted to get that younger, like 4th grade to 8th grade age group. And with the diversion programming, it's a little bit of an older population that focuses more on youth that need more treatment services, youth that maybe have already are using marijuana and need more of a diversion or treatment programming. And then this is also when we started to fund more of an education campaign, starting in 2016 and going on into 2017. And we're hoping that will kind of go out live into the market probably within the next month or two. We've been working really hard on that over the last month or so, and that will likely have some more information during the education panel tomorrow as well. And then we're going forward into 2018, and we finally see a little bit of stability where our funding stays staying the same, and we're focusing our efforts really in those 3 main areas of the Children Affairs Prevention Programming, the diversion programming, and then our marketing campaign. So as we look back to 2014 and we think about where we were and what we were thinking about as far as what we wanted to do around education, and we really thought about it with our partners that had the expertise in this field, and we wanted to focus on supporting youth in making positive decisions around marijuana in a post-legalized landscape. And what that kind of means is that we just thought it was a unique opportunity and a unique challenge that youth were now going to be in this more normalized world where marijuana was more socialized and more normal, and how we were going to message that to them. And so, and in Denver, it was even more heightened. Some data points around that are that Denver youth are much more likely than their counterparts to use before the age of 13. Denver youth perceive marijuana as a low-risk activity, and the dispensaries in Denver are 3 times more prevalent than in other jurisdictions. And so we really wanted to use this information to find kind of the intersection between positive youth development and the prevention methods. And so that's where we partnered with Office of Children's Affairs and developed this Healthy Lifestyles for Youth program, which provides funding to out-of-school time programs as a cost-effective measure to use that time, that risky time period after school or in the summertime when youth tend to be distracted or have too much free time on their hands and start to wander off a little bit. And so we really funded the Office of Children's Affairs as a prevention strategy to keep youth engaged in pro-social activities and as an opportunity to teach them about how to make healthy lifestyle choices. As we did that, we really wanted to be strategic and thoughtful about where we funded those programs. So based on, we looked at a bunch of different components. We looked at just the different neighborhoods in Denver and the different opportunities that youth had in those different neighborhoods. And then we brought in this well-being index, which is a composite of 11 different indicators, including health and crime and poverty and education. And we looked at what neighborhoods within Denver had more disadvantaged or less opportunities for the youth in those neighborhoods. And then we layered on top of that where the marijuana facilities are in Denver and kind of used in figuring that there would be an impact to the youth in those neighborhoods where there were more marijuana facilities. And based on kind of those 2 things, we identified some priority neighborhoods where youth would most benefit from these types of opportunities. And through that, we opened up a competitive grant process to these out-of-school time programming organizations that would provide, like I said, those out-of-school time programs and after-school or summer opportunities to youth. And so that this final map shows where those investments have been made. The larger the circle, the larger the investment was that was made into those neighborhoods. So we really wanted to be strategic and thoughtful about where those investments went, and so that we could focus on the youth that would most benefit from these types of opportunities. So now I'll hand it off to Leah, and she, oh, nope, sorry, I'm gonna hand it off to Ed.
Thank you. Thank you. So I'm assuming you were all here because you're interested in youth and marijuana, some combination of that and education. How many of you folks, just show of hands, are actually working with or programs that work with youth right now? Okay. So what are the kids calling this stuff nowadays? Weed? What else? Pot. The basics, right? There's a lot of other stuff. We don't have it all in here, but they have a whole other language that they're using nowadays to refer to edibles and waxes and other things. That's part of our challenge altogether, is to learn what they're talking about. So, marijuana diversion. Our office gets funding from the city under the tax and excise license fees, but we've been using that funding to build out a diversion network across the city. Oh, that's a little bit further ahead. Oh, it's not the same. Okay, so our concern is around kids getting their hands on marijuana and using marijuana. That's really what we're concerned with. It's not the same marijuana that existed 10, 15, 20 years ago. There's really high-grade stuff. Kids are showing up in hospitals. So we want every kid to have an opportunity to have a healthy life in every part of their life. And so what we're tasked with is building a diversion network where when they come into the system in public schools or in juvenile justice or even in the community or family setting, they're getting in trouble, they have opportunities to not go deeper into those systems. And that's really what our diversion network that we're working to support looks like. So here you can see the different programs we're funding over the last 2 years. 2016, we started out with Youth Opportunity Behavioral Health Diversion, which is the tealish color, blue color. I guess they're both very close. And then 17 is the Marijuana Accountability Solutions Project. So we have school-based programming, justice, or courts-based programming, and community or family-based programming. So there is a lot here. We're not going to go through each of these. For us, it's incomplete. We still have lots of work to do. For example, you can see on here, we're working with Denver Public Schools, and they are across the city. But the programming that we're helping support is not in every school across the city. Schools need resources, they need teachers to actually run that programming in their schools. So we have work to do yet. Boys and Girls Club runs a great program called PACE. They get kids directly from schools, and when kids complete their programs, they get back into school. So they see behavior, they're seeing behavior referrals for those kids drop substantially. And a program like this, and moving into 18, is expanding to where they're putting people actually in the schools rather than the kids having to go to their locations around the city. Those are a couple good school-based programs. And we have juvenile probation we're working with. They've just started running diversion programming where they're giving specific substance abuse treatment to kids who are reporting marijuana use, but also trying to engage them in alternative activities in the community. And then the Office of Independent Monitor, their program, Bridging the Gap Between Cops and Kids, is a really cool program where we have kids and local police officers in the same room, where kids are learning what their real rights are versus what they believe their rights to be. We all know there's a bit of a disparity there. And police officers are learning about adolescent development and where the kids are at and how they should try to engage kids out in the community. So I'm a big fan of of that program as well. Youth on Record engages kids in the arts, teaching kids music. Kids who are interested in music can go to that program. At the same time, they're going to learn about marijuana and the risks that it poses to them. as practical as it could be harder to sing if you're going to smoke a lot. If you want to be someone who sings, then maybe that's going to be a challenge. So trying to identify with kids, is it really worth the risks that are involved? Okay, so we've been collecting data over the last 2 years using our new, using a tool we've come up with, an intake-exit form at the Office of Behavioral Health Strategies. We're trying to capture all of those programs' work, and they all run differently. They all have different dosage for time and how much time they spend with the kids and what they're doing with the kids. We're trying to capture a large picture of what's going on with them. So demographic data, so we have here around 60% of the population we're working with is Hispanic, not necessarily reflective of the actual city population, but that's reflective of where the programs are located. Like I said, we've got plenty of work to do to reach the other corners and other areas in the city. Here you can see about 13 to 18-year-olds is really the majority of the kids we're working with. 16 and 17-year-olds tends to be the biggest group of kids we're working with. Nearly 60% male youth is who we're working with. Services that our programs that we're supporting are providing, mentoring services, probably a little bit skewed by one of our providers that the majority of what they do is mentoring, and they've given us the largest data pieces. So it's kind of skewing a little bit towards mentoring, besides education as our primary service and treatment being primary services. And then we have secondary services listed below that. Some places don't provide any secondary services at all. So in marijuana diversion, most of our programming is during school hours. A lot of these kids have been sent out of school and they're trying to get back into school. And that's why they're participating in these programs. And the curriculums, they're focusing on socio-emotional learning for the kids, really identifying maybe some of the things going on in their life that's leading them to making those choices of using marijuana. So here we have, kind of unique with what we do in our data is we ask the kids, why are you using? You know, what's the reason for your use? And then we ask them how frequently they are using. And this has been something we've got a lot of feedback on from our programs. We find really to be the most interesting part of what we're doing. So at the top we have the reasons for using, and just to be clear, like you can see in the middle, about 16% of kids saying it helps me feel better. That's 16% out of the 909. So that's 84%-ish actually said no to that question. And it's important to highlight that the majority of these kids are saying that they don't use now or regularly. We're really focused on the kids who are saying that they're using regularly. So it helps me feel better. And then I think it's legal and okay to use. It's surprising. 10% of the kids don't really know it's illegal for them to use. And then we look at some components, family members using, friends using, that would seem to be, have something to do with their use. And physical pain relief. We'll talk about it helps me feel better and physical pain relief a little bit more in just a minute, kids answering that question. So below is current use. We ask the kids when they first come into our programs, how frequently do you use? Now you can see there's this giant bar at the top, 58% say none or no use, and just below, 14% are leaving it blank. 70% of the kids at the beginning of programming are not really talking to us about that. We know based on other data in the city, 75-ish% of kids don't use, period. So one, we know we could have some issues with how we're facilitating that. Is a kid gonna answer that question day one when they first enter a program? Probably not. Or maybe not answer it honestly. So we are aware of that. It's something we're going to work on with our facilitation. But here's some of the other usage rates just below. And here we have side by side current use, which is at intake, and the use at exit or discharge. And again, you're going to see none or kids saying no use or leaving it blank. Lots because they're not sure if they can answer this question to the different programs. I mean, imagine being involved with a justice-related program and so you're being asked about marijuana use, you're thinking, I don't want to get violated and get sent back, or even a school-based program when you're supposed to be going back to school soon. how are you going to answer that near the end as well? What we can see is if you just look at the one to the furthest right in the red, one time per day use, we've seen a drop from the left. It's in the middle, about 7.5%, down to about 1.5%. Shows you that some of these, overall, these programs are making an impact. These kids they're seeing the information about brain development. They're seeing the information about getting pulled over and getting busted 3 days after you last smoked because your car smells like it. They're seeing and hearing this stuff, and we think it's making an impact. It's really a matter of exposure, I think, as far as we see it. So that question, those two answers where the kid said, it helps me feel better, or I use it for physical pain relief. Of the youth who reported using more than once per day, 94% said it helped them feel better, and 70% said, I use it for physical pain relief. Something to think about. You guys will ask us questions in a bit. We have our own ideas about why kids might answer that way. We also know we need to dig deeper. What does physical pain relief mean to a 14-year-old kid? What does it helps me feel better mean to a 15-year-old kid? Maybe they're hearing it from a friend or a parent who has it prescribed to them. We're not really sure. So we know we have to dig deeper on this, but really concerning to see this, and it leads us to a lot of other questions, probably you guys as well. So some lessons from our contractors, some things our contractors have told us that they've learned. One of them is from probation department saying, we think there's a lot of underlying mental health issues that are undiagnosed, people don't know about, causing kids to use. We want to get closer to that in what we're doing moving forward. So another lesson from one of our grantees, it's very difficult to impact perception of harm. And it's something we talk a lot about in our office is kind of the rising tide of cultural norming for marijuana that we're all dealing with, that it's legal, it's okay, I know people that are using it, what's the problem exactly? And we're all fighting that, and that's what we're seeing with that Healthy Kids Colorado 2015. This was some of the information. I think we're all really interested to see 2017, how the answer to this question comes out. Given we've had a few years and a lot of programming in the city, have we made a dent in that at all? So our office, we've just finished our RFP process for 2018. We're going to be funding 8 programs in 2018. We call it DAB funding, Diversion, Accountability, and Behavioral Health. It's a combination of 2015 and 2016 RFP ideas or concepts. So 2018, so we want to divert youth from more significant consequences and engaging families, increasing availability of mental health assessment for city youth. Also, larger system build out, for example, probation, or the DMV, or public health departments who could maybe do some work. So that's what we're really aiming for in 18. We've got some of that. We didn't get everything we wanted, but we feel like we're going to continue to move forward. We're going to continue to improve our intake exit form, and we're going to continue to utilize research and really push what we think is going on with the kids in our city. I think that's it for me. I realized on the way here, my office is moving today. I do not have business cards. So for anyone who wants my email address, I'll just tell you, it's edward.charleson, CHARLESON, at denvergov, all one word, .org. I apologize for that. That's it for me. Thank you.
Good afternoon. Thank you all for being here today. My name is Leah Emmerich, and again, I work at Denver Public Health as the Youth Substance Abuse Prevention Coordinator. So I'm going to be talking a little bit about the importance of engaging community in our marijuana prevention efforts. I wanted to start with this idea that came from Simon Sinek about really, with whatever engagement work you're doing, of thinking about starting with the why before you decide what the what is. It can be really easy as prevention experts to think you know what the right answer is for the problem, but without that context of community and lived experience, you may not be presenting the best strategies to the communities you're trying to serve. So I'm going to start with the why. It's expensive. It takes time. It's not always easy to engage with community partners. So really thinking about the importance of having community members at the table is really critical. This statement was actually developed from the Colorado Department of Public Health and Environment at the state level. Their Office of Health Equity came up with this kind of definition. So really just understanding that community wisdom is necessary to learn about health, and that communities really intuitively know what they need to be healthy, and that we'll come up with more complex solutions to the problems we're trying to face if we can engage community partners from the beginning. Oh, these are not my right slides. So now I'm going to talk a little bit about how you can do that engagement work. So we understand that it's important to have folks at the table so that lived experience and different youth voices can be heard in the process. And I'll tell you a little bit about how we're doing that here in Colorado, and just some considerations that I feel are important based on my history engaging with community. This framework some of you may have seen in the past. This is called the Strategic Prevention Framework Partnership for Success model. It was developed by SAMHSA, so at the federal level, the Substance Abuse Mental Health Services Administration. And it really is just this process of engaging community where you're starting with assessing the needs. So that's data collection, doing data walks with community, building capacity, bringing those partners, those community voices to the table, doing strategic planning with your community partners, and then actually walking through implementation and evaluation, again, with those partners at the table. At Denver Public Health, we are fortunate that we are receiving funding that supports marijuana prevention on multiple levels. So we actually have funding from SAMHSA that comes through the Office of Behavioral Health to utilize this framework across the city. That's one of the community coalitions that I facilitate called the Denver Partnership for Youth Success. We also have a grant from the State Department of Public Health that's supporting a similar model called Communities That Care. And our Communities That Care framework is being implemented in smaller populations in Denver that are higher need. One is a southwest portion of Denver that has high needs, and also the LGBTQ community. So those frameworks are leading our prevention efforts. But I just want to point out that there are multiple frameworks to consider as your agencies are thinking about engaging community members in this prevention process. Communities That Care and the Strategic Prevention Framework are only two of many examples. I have a few more examples here to show you, just to really point out how similar some of these frameworks really are. So many of them are asking you to go through a process of evaluating data, looking at the problem, getting people organized and bringing them to the table. Again, doing an implementation and evaluation phase. Sustainability and cultural competence are two pieces that not all frameworks have here, but I would encourage you to consider. I highlighted 3 of the rows here, where across all 5 frameworks that I pulled as examples, they all have a similar steps involved, which is again doing that data analysis, strategic planning, and then an implementation evaluation phase. So I have linked in the slides some resources to lead you to more information about these frameworks if there's interest in learning more. Another big consideration when you really have that understanding of why we need to get people at the table is thinking about who needs to be engaged in your prevention efforts. So the 12 sectors that SAMHSA recommends bringing to the table, they've outlined as the 12 sectors to engage in substance abuse prevention. Youth are at the top of that, as well as parents. businesses, media, schools, youth-serving agencies, law enforcement, religious organizations, civic and volunteer groups, healthcare professionals, state, local, tribal governments, and other substance abuse organizations. Some communities may have other folks to bring to the table. We used this framework this 12-sector list in trying to establish our initial coalition. It's challenging to get all sectors represented at all times in the process, but it's something that we strive for. Another thing, as I think about that cultural competence in engaging community, and something that has come up a lot in the marijuana prevention specifically, is realizing that you can't go into a neighborhood and ask people to come to the table and talk about upstream prevention when they're having trouble meeting their basic needs. So I highlighted here, this is Maslow's hierarchy of needs. You can dig into it if you have interest. My background's in human development, early child development. So this is really an important concept to think about when you're engaging community. Sometimes we go in and we're meeting with folks who have a lot of real life issues that are leading to substance use. And it's not as easy or straightforward to just talk to them about these primary prevention strategies that we have. If they're not able to pay their bills or meet their family's needs, our homeless youth are a big population that is more likely to use substances. There's really a responsibility of the community to find ways to support those basic needs as well as provide these prevention services. So it's not always easy to do. So just understanding that you as a prevention specialist or someone who works with youth, really just acknowledging where you're at in the hierarchy, but also as you're engaging community, if you can use language that meets them where their current needs are, you'll be more successful than just talking about these upstream approaches. Another piece that's come up already and that we'll continue talking about today is positive youth development. So really thinking about bringing youth to the table in developing, planning, implementing your prevention strategies. Our coalition has brought in youth at different points of the process to really get their input, and that has been most valuable. Although some of our prevention strategies are targeted at adult populations, the youth really have a really good insight into, how do you want parents and adults talking to you about substances? So we want to make sure to include them in the process whenever we can. So just to go along with that inclusivity piece, when you're thinking about partners that you want to engage, I would just encourage you to think about this kind of filter of inclusivity. Oftentimes when I'm working on engaging with community partners, it's because it's a win-win for my coalition. So I need you at the table because you're on my 12 list. We really want to make sure that it's also a win-win for the individual who's coming to the table. So that might mean incentivizing their participation or just offering other ways to support their needs. Some of that just includes opportunities for them to grow and develop in this process as well. So it should be a win-win for the individual that you're recruiting. It should be a win-win for the agency and for the community. We often wind up bringing folks to the table who wind up just being tokenized in their presence. So really that authentic engagement requires going a little bit further. I just want to point out another thing that I am trying to work on is the idea that cooperation does not equal collaboration. We do a really good job bringing people to the table, but when we start talking about how can we leverage our funding or how can we really support similar shared goals, there's always roadblocks that we have to face because all of our agencies that do have funding for prevention are kind of living in different silos of our grant requirements and what our agency's priorities are. So collaboration really involves making tough decisions and making trade-offs about what to do and what not to do. And it oftentimes is a net cost for your agency because you have to give something up in order to get something back. So I want to just end my time by sharing a little bit about what we're doing in our prevention work at Denver Public Health and through this coalition work. I won't get into the details of the strategies, but just kind of high level what our intentions are. And if folks are interested in learning more about how the strategies are developed, I can certainly share those. So what we're doing in general is taking a shared risk and protective factor approach to prevention. So with those community partners at the table, they're really at the heart of what our prevention work is aspiring to do. So we're really acknowledging that each person has an individual path that they're following through life, and they all have unique risk factors that may be leading to the potential for substance use. At the same time, each person has protective factors in their lives, a trusted adult or a parent or someone who they can rely on. And so through our community engagement work, our overarching goal in our marijuana prevention is to really excavate that mountain of risk factors that face youth. So we're going to try to get as many of those risk factors that are, can be impacted at a community level out of the way and build some more infrastructure for protection. So that goes into some of the programming that was already mentioned today. Those are opportunities for youth to have more protection in their lives and lead to healthier outcomes. And so just a final thought is when you're thinking about engaging community members and youth into your prevention work, just kind of realizing that that collective vision can be so important. And that I really see that the most beautiful future for Denver's youth is not going to be the result of one program or one of our agency's initiatives, but really thinking about how can we weave together the hopes and goals of the individuals that we're serving. So just reminding you to keep community at the heart of what you're doing, particularly our youth. I too forgot business cards, so my email is Leah Emrick, EMERICK @dhha.org. Thank you.
Well, I do have business cards, so. So, as Molly introduced, my name is Brianne Goldman. I am the curriculum designer with the Yes Institute, Youth Empowerment Support Services. And we are a Denver area nonprofit that teaches emotional intelligence through a really innovative peer mentoring model for an in-school 4-credit class for grades 6 through 12. So we're with Denver Public Schools, Westminster, Adams City, and we are looking to expand as well. So the core of what we do is we teach about community and how to build trust within that community. We also teach students how to have a healthy relationship with themselves and with other people. We also focus on financial literacy, drugs, substance abuse, all through the context of a very strong social justice theme. We do work primarily with communities of color, so a lot of our work is culturally responsive to the groups of people that we work with. So specific to this panel discussion, the Yes Institute was contracted through the City of Denver After School Alliance to create a very customized 10-lesson curriculum designed to teach kids about marijuana use specifically. So some of the groups that we work with are Denver Public Schools, Boys and Girls Clubs, Girls Inc., Mikasa, and several other organizations as well. Before I get a little bit too into the weeds here, no pun intended, I'd like everyone to please stand up, if you are able, and introduce yourself, or to several people standing around you, your name, where you're from, and the next piece here, if I can get your attention. So the next piece here, ladies and gentlemen, is to please, wow, I think we all needed this little stretch break, to please share what your experience with drug education has been as a kid. So either through formal or informal experiences, through an in-school program, or just informal experiences with drug education. So what that was like for you. And then any myths or facts that you remember hearing as a kid growing up about marijuana. So just take a couple of moments, share with each other.
Should we do it?
What was that?
Oh, we're still live.
Yeah. So your drug education piece as a kid. So what drug education you had, and any myths and facts that you had heard growing up. So I used to teach middle and high school for about 14 years. Every year, without fail, I would have a class right after lunch, and students would be half asleep and kind of disengaged. And we just came back after lunch, so I'm just trying to get the blood flowing again. Just a show of hands. So your drug education as a kid consisted of scare tactics. Say the vast majority. How about your drug education as a kid consisted of a lecture or a presentation by an authoritative adult figure? All right. So Healthy Lifestyles 2.0 is not that. Neither scare tactics nor a presentation. So there are times and places for those types of methodologies, including presentations, but this, in terms of engaging our youth, that is not one of those methods that we employ. So what we do and who we serve, how we do it. We are servicing more than 1,000 youth in grades 6 through 8 enrolled in Denver after-school and summer programs. What we do is design curricula that intersects positive youth development with prevention and diversion. So quite a few of the methods that our speakers here were mentioning, we just kind of go a little more in depth. And how we do it is through interactive games, peer-led discussion, personal reflection that are aligned with instructional best practices. So our youth that attend these programs are there by choice. They're not forced to sit in their seats. And so the activities have to be engaging, have to be interesting. And most of all, peer-led. That's really, really important. So our goals for this curriculum is to educate youth about the marijuana issues that they are and will be confronting, equip them with tools to address these challenges, and then inspire youth to educate their peers about the risks associated with adolescent use. So some of these tools that we use, again, are these peer discussions, these activities, but also refusal skills as well. How to deal with peer pressure, because it's going to happen, but in a much more positive way. And we collaborated with topic experts for targeted, consistent messaging. So we consulted with neuroscience resources, with marketing experts, again, with the terminology. We kept the term marijuana, again, just because that is the language used in Amendment 64. But it's also really important to note that a lot of the words that maybe we were familiar with growing up as kids, like pot, for example, or grass or reefer, aren't necessarily the most appropriate words to use at the time. So really weed is the word that's being used most often. So our approach, like we have talked about, is positive youth development. So just a show of hands, who here has heard of that before? What PYD is? Yeah, about half. So we employ that. So basically what that is using an asset-based approach. So a strengths-based approach for kids rather than the heavy-handed scare tactics approach that has been used quite a bit and to mixed results. We also use social emotional learning standards. And I consulted with the CASEL standards, so Collaborative for Social Emotional Learning, as well as the Colorado Department of Education standards. So everything is standards-based, so aligned with health, science, literacy, the arts, physical education, and social studies. So metacognition and voice and choice really guide the entire curriculum. Students are encouraged to think about their thinking, to really identify, okay, what are the choices that are in front of me? And why am I making those choices? So really go a little bit more in depth there. One of the goals here is to encourage youth to understand they are completely in control of their own decision making when it comes to this, and to give students the resources so that they pause for a moment if they are confronted with a situation where they may be offered some edibles or any sort of form of marijuana, that they actually pause and say, okay, why am I choosing this? Why am I doing this? The other piece is voice and choice. So lessons are scaffolded. So different levels of ability. So the teacher can tailor the curriculum depending on who is in front of them in the room that day. So we do have some sites with only 3 or 4 students, and we do have some sites with 15 to 30. So it's going to, your population is going to vary depending on, your lessons are going to vary depending on who's in front of the room. Youth are challenged to consider their identity, their goals, the impacts of their choices. And again, like I said, everything is youth-driven, inquiry-based, interactive, and relevant. So our 10 lessons are divided up into 2 levels. So the first is the 101 series, which is a little bit more prescriptive, kind of basic. And the 201 dives a little deeper into what students learn about in the 101 series. So the first lesson is called Mythbusters. And I gave just a couple of sample objectives. You can get a kind of a broad view of what the curriculum looks like. Youth will explain the difference between a myth and a fact. Youth will learn about the laws, the health uses, consequences of adolescent marijuana use. The second lesson is marijuana, brain, and body, so they dive a little bit more deeply into the science. They'll understand that consuming THC as an adolescent can impact memory, coordination, vision, balance, and other body systems. Youth will be challenged to compare healthy brain function versus impaired brain function. So we teach students about neurotransmission and the endocannabinoid system. So these are a lot of things that maybe we weren't taught as kids, and maybe some of our physicians aren't necessarily as familiar with the endocannabinoid system. And so this also gives students power in understanding this body system and how marijuana is playing the role in that. The third lesson is identity and choice. Youth will identify their role models, and they will understand that they are role models for other people. They will understand how their peers or their tribe may influence the choices that they make. So I recently heard this awesome quote, "Your vibe attracts your tribe." Has anyone heard that before? So your vibe attracts your tribe. So the energy that you're giving off to other people influences the people that are coming towards you or kind of you're repelling. So what are you doing to influence people around you in maybe positive and maybe not so positive ways? The fourth lesson is rights and consequences. So youth will review their short and long-term goals and explain how marijuana use might impact their goals. Youth will understand and explain their rights and responsibilities as adolescents. And then the fifth lesson, history, trends, and culture. They will evaluate the global history of marijuana. They will analyze the impacts of prohibition from 1937 through legalization 2014 in the United States. And like I mentioned, there is a pretty strong social justice piece in this curriculum. And we talk a little bit more about the term marijuana and how there are racist implications behind that term, so the etymology of the word. Students in this activity will create what's known as a human timeline. So there's a large piece of yarn, it's about 20 feet long or so, with different markers that the students will stand at. So you have the year 0 as sort of a guidepost, and then 200 BC, and then 12,000 BC. And then on the other end, you've got 1900, 1920s, 30s, all the way up to 1980 in present day. So the facilitator will read out a fact, and the students will have to stand where they think that that fact happened in the course of history. And it's fascinating to see where what people's understanding of history actually is, specifically around cannabis, marijuana use. So the idea here in this lesson is to demonstrate that the word cannabis or weed has been used throughout history up until around 1937. 1910s, 20s, Mexican Revolution, there was a very large influx of Mexican immigrants to the United States. And so there was a backlash. And the term marijuana then superseded the word cannabis and weed, and that's kind of where we're at today. And so we actually talk about that. We talk about that with the kids, the history of words, why our words matter, and why communities of color have been disproportionately impacted by the war on drugs. Just to give students a little bit more understanding, a more holistic understanding of marijuana and the issues that they are facing and in their communities, and not just at home, but the broader communities, their neighborhoods, their schools, cities. And so I can stand up here all day and talk through a PowerPoint about how our curriculum is not a PowerPoint. So we are going to engage in an interactive activity. So I'm thinking we're going to divide up into, let's do maybe 4 groups. And if I can get everybody to stand up again, you can stretch, move around if you like, 4 separate groups, and we'll stand in really large circles if you can. This is one of the introductory lessons to the entire curriculum. So it's in the Mythbusters lesson. So what you received right now is a card that has either a myth or a fact printed on it, but it does not say which is which. So what you're going to do is the first person with the ball of yarn will wrap a little bit around their finger so it stays secure. Take a large piece. You'll then read your card, and you'll toss the ball of yarn to somebody across from you. That person will then do the same thing with the yarn on their finger. Read the card, toss it to somebody else.
I don't know. I don't think so. Brianne, are we supposed to answer whether we think it's a... Are we supposed to answer whether we think it's a myth or a... No? Okay.
Yeah, there's a question if you answer, if you think it's a myth or a fact, if you read your card and then answer it out. I know what you answer.
You must be 18 years old to buy recreational marijuana.
Anybody want to make a guess as to what this was all about? Why did we do this? What's the purpose? Okay, to identify myth versus reality. Okay. Anyone else? Keep everybody engaged. Perfect. Left and right brain. Uh-huh. Absolutely, yeah. Myths or facts are so interconnected into this massive web. We really want to highlight that in a very visual, interactive, physical way with these kids. And so this lesson, this activity introduces basically the rest of the curriculum where students will be discovering for themselves what's a myth, what's a fact, where did this information come from, and what are some really helpful resources I can use to find the information for myself and for the people in my world. So this activity leads into something called 2 truths and a lie. So after they're disentangled with their yarn, they will work in small groups to identify on cards two truths and one myth. And they have to discuss with themselves, okay, which are the actual true statements and which ones are not true. Once they come to a general consensus, they turn the cards over, and that's really where they understand more of the information that you learned as you did this activity with the different fact cards. So what questions do you have on this activity? If you have any. That's a great question. All you need to do is just kind of release your finger. That's fine. I'll take care of the rest. It's a big mess. And I do believe we have time for full panel questions. Is that right, Molly?
Yes.
Yeah, so you can go back to your seats. Thank you all so much.
All right, so we have a couple of minutes for questions. If anybody has any questions, feel free to come on up and to the microphone. Hi.
Hello. It's hard to be the first one. My name is Sarah Tone. I'm with Washoe County, and one of our initiatives is to go out into the community and maximize our education plan between our different partners and our collaborators and help make sure that our resources and our finances are going as broadly as they can in the community to educate. And I'm struggling a little bit with how to get everybody in the same room on the same page within their various expertise levels to all join together. And I'm wondering if you had that opportunity to work in your community or if you'd found any solutions to that. Thank you.
I can start. I think this is a challenge for everyone that's trying to do that community engagement piece, is that even agencies that have funding for prevention that comes from different sources, that we often aren't in the same rooms talking about how to maximize. a lot of my efforts have been just kind of self-discovery and meeting with people and trying to learn who's doing what. We're talking about, is there, a way for Denver to do a better job of kind of having a place where we can document shared resources and shared opportunities. I'm not sure if other folks have
Sure.
suggestions.
I'm on. You guys can hear me? Okay. So our office, when Regina Herder, the executive director of our office, wrote the first RFP for 2016, she's a very clever RFP writer. She asked for collaboration amongst multiple organizations in the RFP, that when people made proposals, they demonstrate that they're working with other organizations to kind of build bridges. So whatever they can't do, maybe someone else is doing in collaboration with them. So she asked for actually 4+ connections or collaborations to be demonstrated in an RFP, which kind of forced people who wanted to get the grant funding to use their own networks and kind of put pieces together and make proposals that way.
And Ed, correct me if I'm wrong, but you guys meet monthly with your contractors,
Yeah.
is that correct?
Yeah, we all meet as a group every month. We have for the last few years, well, this past year. And we continue the conversations as we learn, and everyone continues to speak at events like this and meet new organizations. And we found out ways that we can help each other. So after we establish that first group, we meet regularly, and it's become a group that really depends on each other for a lot of different pieces of services and referrals out to other services for kids that maybe they can't meet the needs best.
We were also lucky that we had the Office of Children's Affairs that was already established and had a grant program that they were already running, and so we leveraged that to build the Healthy Lifestyles for Youth program. And they also helped establish the Denver After School Alliance, which is a partnership in a community of after-school programs and organizations that have that communication and coordination, and we're already talking about this subject. So we had some existing framework to build on.
Hi, so I'm David from the Edmonton Police Service. I'm curious about one thing. We've got police officers in high schools and junior high schools. We teach smoking education in grade 3. We do traffic safety in grade 1. And we've got kindergarten teachers that are after us to put police in kindergartens because they can tell who the bad kids are going to be, 4, 5, 10, 15 years down the road. Why did you land on grades 6 to 8 for this particular program when you could have gone higher, you could have gone lower? What was it about that particular age group that led you to believe that this is where marijuana education should start?
So our Healthy Lifestyles for Youth actually goes as low as 4th grade. So we do go a little bit younger, and then I think Ed's program goes up to age 21. So we have different programs and different age groups for those different programs, and we try to hit a broad range and target the program towards that age group.
And Boys and Girls Club, for example, they go down to 5th and even 4th grade with some referrals. It depends on the behavior referral that gets the kid into the program. So maybe the majority of the kids are in that, 7, 8, 9-ish, but we have kids on both fringes that we're working with as well.
And just to add on to that too, one other thing that we really tried to do with our initial approach was to go deep, not necessarily wide. And so that's why we chose these types of programs that have that close one-on-one and direct interaction with the youth. Now we're moving into this more broader marketing, advertising, education campaign, which will have a wider reach, but we'll continue on with this programming that really has that depth approach. Yep.
Hi, Tim Stiles from the Canadian Federation of Municipalities. We're based in Ottawa, Canada, but we have members across the country. And I'm just wondering if any of you were around or have colleagues who are around for the initial discussion about cannabis and the education side of it, and if you knew back then that Denver was going to be receiving $2 million to do the great work that you're doing. Because a lot of our members, we don't have that clarity, and so we're kind of looking to tease out some lesson learned in terms of where did it start from the beginning, and how did you get to where you are in terms of the necessary funding to do your work?
Right. Do you want to?
I'll
Start.
start.
You're at the start.
So I started in this position in 2014, so I wasn't around before that. But two things is one, I would start collecting data as quickly as possible and teasing out marijuana-related data from that as much as you can. That was something that we didn't really start until 2014, whether it's in usage or DUI. In this context, it would definitely be around education and youth usage. So that would be one recommendation. And I would say in Canada, across the United States, I mean, it's already normalized and it's already socialized. So we can start now with education and that type of messaging sooner rather than later.
I would just say the family engagement piece has kind of risen to the top for us as that area where there's that cultural piece that the families are reinforcing in the homes. And I think in the beginning we looked at how can we get involved with school systems or larger systems and work with kids and teach them about the risks. But you start to see kids, their own attitudes about it are, it's fine, it's legal, I'll be able to use legally. And I mean, our feeling is that's being reinforced at both home and in the community. And that's where, we're starting to think if we can engage there, we can really make a change, but it's the hardest place to engage as well.
And you hit on it already, but funding,
Yeah.
to advocate from the very beginning to have a dedicated source of funding for this type of education, I think is critical, especially as we go and it becomes even more and more normalized.
Thanks.
Any other questions? Oh.
Hi, I'm Katie Williams. I'm a detective with Breckenridge PD for Ed.
Yeah.
What are you doing for that 18 to 21-year-old group? We have a ton of tourists that come to my town.
Right.
They're on spring break, so they're not in our schools, that we can give them proactive messaging. They're coming on vacation with their fake ID, trying to buy weed to send home. What messaging are you doing that I can ride your coattails?
I wish we had that messaging, I think, as kind of on the messaging front. But it's an important distinction. Diversion is not just about youth necessarily. We're having young kids, college age, lose college funding. We're having them getting DUIs 2 or 3 days later after the last time they smoked, and they're not in the programming with a lot of this other youth diversion. So a few of our programs, the Office of Independent Monitor program does work with kids up to, or young people up to like 21 to 24, and also the Youth on Record program is working with that group. But the Yes Institute is one of the places that we've talked about them engaging kids at the college level and maybe looking at developing stuff with local universities so they have diversion classes. So if kids get caught on campus, they could have to maybe go to a class to stay in school in lieu of losing some kind of funding. But that's just one of those things we're thinking of now. We don't actually have any of that in place yet, but it's an age group we're also really concerned with in how to engage them. Some of these kids have no choice. It's justice or school discipline. So how do you get a 19-year-old to engage when they're the kid going to Breckenridge and trying to buy and trying to send it home? How are you trying to let that kid know these risks are real serious and you need to think about this?
And I would just plug the public education strategies session tomorrow morning. There'll be a lot of conversation about that, both at the state level and Denver, and then the folks kind of sitting behind you are working on our campaign, and they might have some thoughts about that as well.
Hi, I was trying to go to both concurrent sessions, so I may have missed this, and so I apologize if you already gave the answer. Is this creative curriculum you were describing publicly available, or is it all copyrighted and you need to buy it, for the first question? And second, are there results yet about whether kids who go through this program are less likely to use marijuana as adolescents?
So right now we are piloting it. So I just led the trainings for our site leaders. So we don't have that data yet, but the anecdotal evidence that we do have that has been positive for sure. In terms of it being available, we are looking at that, definitely. So if you're interested, we can have a conversation. Thank you.
Hey, I've gotten questions before about perhaps engaging in a youth prevention advertising campaign of some sort. In my experience, those campaigns tend to be maybe a little tone deaf, or they don't quite resonate with youth. What has your experience been with that kind of thing? And do you have any tips or resources if we were to try to engage in a public campaign for youth prevention that could really resonate and be effective?
So I'm going to punt that one a little bit until the public education strategies meeting tomorrow. Dan and that group will definitely have some thoughts around that. Allie Maffey from the state has done a lot of great work, and I think it's called the Trusted Adult campaign, and so could definitely have a good answer for those types of things. And we're trying, as we're building out our campaign that we're launching in the next month or two, that's something we're really trying to be thinking about and consider to make sure that it's something. We did focus groups, and we really tried to make sure that it's something that will resonate with the youth.
And I know our program, one of the programs we support, Youth on Record, takes an artist-based approach, maybe with kids who are engaged or interested in music, and trying to deliver messaging through that versus being lectured to in a setting. And I know that they work with another program called Check Your Head, which was very similar in schools, that were trying to use local artists and teaching them how to actually deliver messages around marijuana and also stuff about suicide prevention.
Okay, anything else? Yes, more to come tomorrow. This used to be one combined presentation. We separated them out because there's so much now. So, all right, well, we'll stick around if anybody has any other questions. Thank you.